can't be a case of, oh, let's just deal with that patient. See, this is what's so scary, right? If you're a patient, okay, that you don't present with, like I said before, you have no symptoms at all, no inflammatory markers, there's no telltale signs in your blood, right? Then you're pretty fucked. Excuse the sun. You're screwed. The only thing that's going to work, for me to get help, is if you're going to listen to me. Because 9 times out of 10, when I've contacted the nutritional nurses for the line, and I've said, I'm coming in, we need to do some cultures. 9 times out of 10, there's something wrong. And it's interesting, because even this time around, when they were still doing my cultures, nothing picked up. But there was still a bug there. Personally, I'm thinking that the alcohol in the line kind of like concealed that. It sounds crazy, but I'm thinking that. Because, before I had the alcohol lock, I think it was towel lock I had, didn't really agree with me. But when I got line infections, I was getting line infections like every 11 weeks, I was getting them all the time. Just somebody that's prone to line infections. But then coincidentally, when they put me on, they changed it to the alcohol, 70% the alcohol. I just happened to not get any more infections. Was that, I'm not wishing it on me, but was that a coincidence, or was that, do you see what I'm saying? Or was it because I actually still felt infected sometimes? Anyway, my doctor, this particular one I'm telling you about, as usual he was understanding, as usual he was empathetic, as usual his bedside manner is on par. As usual, the man come like he should be the goddamn daddy. As usual. He understands. And because he already knows about the situation with me in 2018, he understands exactly the situation. I said to him, you know what? I said, the best thing that anybody ever said, which was you, I said, all those years ago, is when you said we should refer this woman to an immunologist. 2018 he said that, and it was written down for them to do that. Never happened. They said she needs to see one. Because her body is not even letting her know when she's sick. Her body is not letting her know when there's a threat, when her bloodstream's been breached. She could be walking around like normal, climbing up to wherever, doing whatever she's doing. Nothing shows. No bloods, no nothing. No abnormalities. Abnormalities. Yeah, that. Right? Until it really gets bad. I mean bad. Then I crash. Then I'm already in trouble. Then I'm in trouble. That's the only time that things spark up. Otherwise, until then, nothing. And I swear, as God is my witness, the only thing we have to go by is when my gut changes, my output, my stoma, which is a sign, isn't it? Now, if I'm telling you, imagine for months I've been telling you it's greeny bile, it's greeny, or slimy brown. I'm telling you that it's bug-like. Then you turn to know what I'm talking about. That's not normal. That's not my norm. For all those months, I knew something was wrong, just like I knew in 2018. But yes, in March you continued to let me slide down. And you could have well done the same thing again. If I wasn't me, you would have done the same thing again. If I wasn't me, you would have done the same thing again. If I couldn't be bothered and was tired, you would have done the same thing again. I'd have been dead. I would have ended up just going down. Why shouldn't I be concerned? Why shouldn't I be concerned? Can you understand that? You can see I'm not no weak. You can see I'm not no weak link. You can see that I'm going to talk to them. If something's not right, I'm going to give them a call. You can see that. You can tell. You can hear that. I'm a strong woman. Now, can you imagine I'm telling these people for nearly 8 months? I've had no appetite. I've been eating nothing. I've been barely eating like little baby amounts. And normally I eat like a man, like a dog, right? Can you imagine? I'm telling you that. And all you're doing is talking about, the PN. Well, I personally think we should just reduce it. What's wrong with you? What's wrong with you? You know, I get you ain't got enough beds, and I get that you can't afford to keep one patient on this treatment. But don't make me start feeling uncomfortable like you know, like you're trying something here. Don't make me feel uncomfortable. Don't let me start feeling concerned. Because even when I was saying to the doctor yesterday about, we were talking about my veins, obviously, after that thing. And I think they've got a specialist line. Now he did suggest, how about trying a tunneled pick? Now look how I was just uploading that thing talking about lines. What was I just saying about not knowing? The only thing I know is whatever, until I found out about those other lines. So whether it's a new thing, the tunnel pick or not, but I only heard of it yesterday. Him himself said he's concerned too, because my access isn't that great. I know my chest is still good, but my arms are not that great. Obviously, we've used them a lot. I get that, but whilst there's still some there, we can use that. I'm not a complete write-off yet, so don't write me off. Don't write me off. You know, it's very hurtful, because sometimes they come across like, oh, you're not the only patient. Yeah, but I'm your patient. But I'm your patient. And just like any other patient, they've all got their needs, right? They've all got their complex cases, or whatever the situation is about them. And mine is this. Mine is I'm a complex case that you've known for over 20 years, that you know how my veins have been. It's not new. That you know the struggles. That you know the struggles. You've done nothing to preserve them for all those years of knowing me. But this time you already knew, if we continue to beat down her veins, then can you imagine in 10 years' time it wouldn't be so good? You already know that. Think about that. Think about that for a minute. They already know that. Of course they know that, right? So can you imagine each patient that they've got? And say I've got, like for me, my veins have never been good. So can you imagine if you're beating down all these veins, really and truly, and you're beating them down, and then when things get worse, you start going on the grind, you start to go to certain areas. You're shortening their lifeline as far as I'm concerned. Like I was saying before, how are you preserving my life? How are you taking care of that patient? I'm not expecting special favours. What I'm expecting, when you are dealing with me, that you know how to deal with me. I'm not no different from any other patient. When it's any other patient, you deal with them. You deal with whatever their needs are, right? So for me, it shouldn't be any different. You know this patient has very difficult veins. You know that straight. I'm not the only person in the world that has difficult veins. You have specialists that can deal with those veins. You do. You do. But in the meantime of that, don't let me suffer. You shouldn't be allowing me to suffer. Don't put me in positions where I'm going to be abused. And that's all straight it is I'm being abused. That doesn't sit, that's not okay. That's not okay. That's not a part, come on, that's not a part of no shortage of NHS staff or, you know, cutbacks of money. That's got to do with it. Don't watch me get abused when you damn well know, all of you, all of them. If you was to say to anybody in St. Mark's, Kiki, what Kiki's veins like? They'd be like this. If somebody said, oh, we need to get blood from Kiki, they'd just be like, they'd be doing a U-turn and running. So what I've got left, take care of. You need to help me to take care of them. Obviously, the only thing I can do when I'm in the other hospital, when people want to keep abusing me, is just say, nah, brethren, you know, that's enough. That's enough. Because I'll let you try 20 times. I'll let you try flipping 25 times, up to 30 times. Are you kidding me? Are you kidding me? How are you preserving my veins? That's what I'm saying. Why haven't you suggested those other lines? Because look at those people that deal with dialysis. Those patients. Now they're particular specialists, aren't they? They deal with certain veins. Look at those people with dialysis. Look at their veins. They're shot. They deal with. So I don't understand. Can you imagine? No one's even referred me to even them. You've never even bleeped them when I've been when it's in my times of trouble over at the other hospital. Of course I'm vexed. I may sound repetitive. Of course I'm vexed. I'm pissed. And you know, it's interesting. It's okay to say, well, you know, you're here now. You're sorted. Okay. Okay. This is the recording that I'm doing. But if I was to have started to have recorded way back when it was all started, you would have been like, rah, what's going on here? It's the same cycle. It's the same cycle. And someone needs to tell me something. Like I said, you know, it's only now they're deciding to train some people over there. Quite frankly, you should be goddamn ashamed of yourself, Saint. You'd be ashamed of your goddamn self, considering that's the hospital that you was based at in the first place. Can you imagine that? You was based at that hospital, and even when your patients used to come in to see you at that hospital, we had to sit down and wait there, because naturally they're all up on the ward. They can't just come down. There are things to do, take care of all those patients, yeah? But you've still got to wait and find some time whenever they're free, because they're doing their jobs, to come down to take bloods or do cultures of their patient in A&E. What kind of bullshit is that? What kind of long-term solution is that? And when you look at the history of St. Mark's, it's been going forever. What is this? Is this where you've got? Is it so from your beginning till now? Is this how far you've got? Is this all you've got? Is this all we've got? This is your improvement. So it's interesting how all these big bugs, they improve by doing all these researching and founders and, you know, whatever they do, and they got their gold trophies for doing this and finding this, and they're specialists in this and doing that. But here in the hospitals, your hospitals, is this how far we've got? On the other hand, side of your glory, nowhere. You've got nowhere. It's a frightening mess.